More success this week. Hello, everybody. We had a few glitches for a few minutes last week, but this week, Christina's conquered all, so that's all good. So it's, of course, Tuesday, the 23rd of February. Time is marching on. We're almost into March. Mm-hmm. Exciting. Our snow is nearly melted. It's starting to feel like spring here. And things are turning green. So that's good. Wherever you folks are, welcome aboard. We're, of course, doing a Facebook Live. Today's topic is mental health. I encourage you, now is a good time to turn it on if you want to share it with anybody. And if you don't manage to achieve that, you can go to drbillcode.com and, read about myself, or you can go to Mind Mood Microbes. That's Christina's website, and get connections to that. But if you look under blog on my website, you can find this on a YouTube video. And eventually it'll soon be on an audio podcast too. So you can download that for when you're traveling or whatever you're doing. Maybe you do it while you're walking. I can't do it while I'm running. I'm not that clever. It doesn't work that way. So today we wanted to talk about the chapter on mental health, which is chapter 26 in the book, I believe. But the key thing about that is, of course, in the book, Solving the Brain Puzzle, mental health is a very big part. And I think part of what I would like to go over and, get Christina's input as well, that, mental health is really close to physical health. In fact, they're the same thing. We got a little mixed up within medicine because we put all these mental health pieces in a box and gave them to psychiatry, and the other parts we left and gave to neurology. And they don't interact very much. So that's been crazy because they're almost all the same thing. The crises within the brain, whether it's injury or mental health or neurodegenerative disease, including my MS or whatever, are all excess inflammation in the brain with a host of other things that trigger them and aggravate them. With an incredible link, of course, to the microbiome, with the gut-brain connection, which is much more impressive than we ever thought it could be. And, you can follow up with some of this, Christina, but certainly we know now that the microbiome often has moderately specific entities that will demonstrate as different problems. So if your problem is depression or anxiety, it tends to be one group. Not always. And another one is psychoses. Another one is obsessive compulsive disorder, or OCD. Mm-hmm. And also in that, similar set of groupings is autism, or autism spectrum disorder, more correctly called. So it's a matter of trying to tease out what are the optimal solutions for people and letting go of our old traditional concepts. Our old traditional concept in anxiety and depression were, of course, that it was a lowering of certain neurotransmitters. And that's not the case, really. We've never had decent evidence for that, even though that's where all the medications have been so-called predicated on that principle. In reality, they don't work any better than placebo anyway. I'll guarantee they make people feel differently, but they don't solve the problem per se by changing the neurotransmitters. It was a cool idea, I guess, and it sold a lot of drugs, starting right back with the MAO inhibitors and the tricyclic antidepressants in the 50s and 60s, and then all of our new generations more since. So I think if we kind of went through it in a way talking about that, I don't think the symptoms thereof, most of us that are already on this call have either a diagnosis or a suspected diagnosis, or we have anxiety or something within that group. I don't think there's as much magic to the exact diagnosis as there was, because the solutions are all pretty similar. So why don't you, give us the benefit of some of the microbiome concepts that you wanted to, because you've done a nice summary for me.
Well, I do think the neurotransmitters are involved for some people, not everyone, but some. because we do have the neurotransmitters produced in the gut. So we know serotonin, like 90 or something percent of serotonin is produced in the gut. And so depending on what you're eating or putting in your body, you'll be influencing the relative ratios of the microbial populations, and you may or may not have some of the ones that are converting tryptophan or the metabolites into serotonin. There's also some dopamine that's produced in the gut. You've got some GABA that's produced in the gut, acetylcholine, and all of these other metabolites that can influence your mood. Yeah, that's what I would consider there. I guess another direct influence over mood would be toxins. And so I'm always looking for things like hydrogen sulfide X, which in excess is toxic. I'm looking for excess lactate, which can cause mood issues or mood imbalances for people. I'm looking for ethanol and indoles and basically any toxin that in excess could negatively influence someone's mood. Beyond that, I think the gut ties in and the neurotransmitters tie in, but then there's other things to look at as well. So for example, I think oxidative stress in general is going to have a negative influence over mood. And then I guess I'll tie that into, so one of the first quotes that stood out to me in the chapter on mental health in the book Solving the Brain Puzzle was the one where it said, depression is not a chemical imbalance, but it's brain inflammation. And so again, that brings us back into this pattern that we kind of always come back to every conversation, where it's like anything that causes oxidative stress can be influencing the vessels and the blood-brain barrier, and therefore mood.
Well, for sure. And, the other piece within that is we know a lot better now than we did even certainly 10 years ago or even 3 years ago with regard to changes in dopamine. Talk about it for a minute, because excess dopamine and dopamine not, being teased down or going down an enzyme pathway into norepinephrine or noradrenaline, depending where you're living, makes a huge difference, because that excess dopamine is a problem in triggering anxiety, depression, psychosis, OCD. So, and the dopamine, you've started to create what happens. Over half of it, of course, is created in the gut. And the dopamine in an ordinary healthy individual is typically modulated. A fair proportion goes down into norepinephrine, okay? And then some will go on down to epinephrine or adrenaline. However, some people have a relative block of those last pathways, so they're short of norepinephrine, and they can be even short of adrenaline. So all of a sudden now they've got, you can call it POTS, but orthostatic hypotension, and it can be very severe. It may be so dramatic that when they're exercising, they faint because they don't have that little adrenaline surge to get them through the times that it's needed. And all of a sudden, they fall down. And so just to take that a little bit back, we knew several years ago, because of the work of Dr. Bill Shaw and his organic acid test, right? Which is brilliant at telling us, do we have an excess of some of the Clostridia species? Now, most of you have heard of C. diff. That stands for Clostridium difficile. So the other Clostridium entities are Botuli and a couple of others. When they're in relative excess in the gut, they create relative toxins, that you've kind of alluded to, HPA and P. cresol. The names aren't critical, but when those are elevated, you have a dramatic response in problems with autism symptoms, or you can have anxiety, and you can certainly have psychosis, hallucinations. And those are all treatable if you can reduce the overgrowth of those organisms. Now, in days gone by, we used to say that, oh, it's time to reach for the tough antibiotics like vancomycin and metronidazole or flagyl. But now it's relatively more simplified, and I'll get you to go over. But the favorite now of Dr. Shaw and his team at Great Plains Labs and the people that they teach and help educate is one called Core Biotic, produced by Research Nutritionals, which is a great product. I think primarily soil-based, but I'll let you talk a bit about that, because I think in many cases now, we can go specialized probiotic route and maybe some prebiotics along the way, rather than reaching for the big gun antibiotic, which of course has its consequent problems anyway, because it kind of blasts everything.
Yeah. Okay. So if you had an overgrowth of Clostridia and it was preventing dopamine breakdown, how would that make you feel?
Well, the dopamine excess goes right into anxiety, hallucinations, any of these features, and you feel, I guess, unwell. You may or may not have sleep. Often you don't. So the dopamine excess is a real problem. Yeah.
Okay.
So it's a baseline place to start, and that's why, you know, you and I both have become very big fans of the organic acid test, because it gives us information nothing else can. And we're often very surprised by the outcome, but we also are very pleased because it often gives us a modality to react to and treat. So now we're talking about, you know, some of the diagnoses of psychiatry having a solution. Not necessarily a drug solution, because that tends to be only a kind of a superficial Band-Aid, but an under, you know, the apple peel solution, so that we can go deeper into it. And I'm going to talk a little bit about, you know, dairy and gluten in a minute, to talk about how they impact on that enzyme. So in the meantime, let's go back to the things that we would try and improve within the microbiome, so that we can, you know, have less of that excess dopamine and permit that enzyme, which is called dopamine beta hydroxylase, to work better.
Yeah. I mean, I can also talk about my own personal experience, because it's definitely relevant here. I mean, part of the reason I do this work now is because one of the biggest influencers of my own health and mental health has been the ability to manipulate my microbiome. I would say the best thing that I've done is grow the right microbes. So not just focus on like decreasing the Clostridia or whatever else. I did have elevated Clostridia at one point per the organic acids test and did treat it.
Yeah.
But that helped. But then coming out the other end of that, trying to grow the right microbes. So the ones that are producing GABA, the ones that are working on the serotonin pathways, and keeping the potential pathogens in check. That was the best thing. And that's what I aim for with all of my clients as well. And seems to have better outcomes. So not getting stuck on, okay, we're going to reduce these guys, but also making sure that you have a plan for after that too, and building up the good guys with the right prebiotics. And you can also use probiotics to take over on some of those pathways for a period of time as you try and grow them. And so that's where things like Core Biotic come in, or I had some other probiotics listed on that list for you. Like there's one called E. coli Nissel by, it's called Mutaflor, and then the strain is E. coli Nissel 1917. And the strain actually, it was discovered and then started being reproduced in 1917. So that's why it's labeled that, which I find cool. It's a really old strain. But it's relevant for those serotonin pathways and has been found in plenty of research to help with mood disorders.
Well, and sure. And the other piece, just as you led into the concept, we don't necessarily want to beat down one or two species particularly. So, and that helps us think more and more about, the demise or letting go of the so-called germ theory. There's one or two bad ones, and if we get rid of the bad ones, then we're good to go. But that's not true. Mostly it's not true. We just have to keep them in relative diversity and abundance of the variety. And then all of a sudden, those ones that we thought were the problem are better. And so what it comes to, and that's why you leaned in a little bit even when talking about prebiotics, is improving the terrain. So the background that they're all living in, so that they're living more in harmony, supporting one another, interacting with our cells, particularly the gut lining, but also other parts within the body, because the brain has its microbiome as well. So if we can get all of those in harmony by improving the health of the terrain, then we do much better. And of course, the germ theory came from Louis Pasteur, but even on his deathbed, he finally admitted that his longtime competitor, Deschamps, of course, these are both in France, was correct, because the terrain was the important thing. And I mean, gosh knows, we've forgotten that. Even with all the effort on COVID, we forgot about the importance of the terrain and say that, well, there's one bug, and if we just solve that bug, then we're good to go. Much further from the truth.
Yep. Yeah, and there's all sorts of other interesting micro connections that I've discovered over time. Like if you do have the hydrogen sulfide excess, hydrogen sulfide will suppress lactobacillus growth. So you can't jump straight to using, like before I knew this, I tried to just use like legumes and the galactoligosaccharides and things like that to try and grow the lactobacillus. But I had too much hydrogen sulfide and it kept suppressing the lactobacillus. So I did have to use antimicrobials and sulfur pathway support. And then ultimately the lactulose in the end. And then the hydrogen sulfide was gone. And then finally the lactobacillus starts coming up. And those guys are responsible for GABA. And they do play into the serotonin pathways.
Sure. Because each of those pathways are really important for us. And we want them working in harmony. Remembering that there's that huge highway from the brain to the gut and back called the vagus nerve. And it's like a superhighway, and most of the traffic actually goes from the gut up, but some goes down as well as the ordinary actions we used to think of in anesthesia, which was the vagal stuff for the interactive vagus nerve, which made you sick to your stomach, which was one of the problems, slowing your heart rate, another one of the problems. But here we're talking a superhighway of the vagus nerve as far as moving bacteria and other microorganisms up and down. And of course, they do go other routes as well. They can go through the blood, they can probably go through the lymph, and the cleanup that happens within the brain and all these places. And of course, some of those are aggravated when we have a leaky gut, which is the lining of the gut, small intestine especially. But of course, we also have the lining of the endothelium or blood vessels in the brain, which often if you have a leaky gut, you have the leaky blood-brain barrier. So now we've got another access point. Because days was not that long ago, we thought that the brain and spinal cord were sterile. They didn't have any organisms in it at all. But it's not the case. We've got a large number of organisms there all the time. In fact, all of our new messaging, as in a virus, for example, you can call them exosomes because there's probably almost no difference in those two, can often become for your new so-called software update. So now you've got a new stress in your world. It's suggested now that maybe the issue that kicked off the heavy-duty 1918 flu was the new onset of radar and radio waves, okay? They were used in a major... So the body didn't know what to do with this. It had done all this evolution over thousands and thousands of years, but now you've got a new curveball thrown at it. So it eventually finds a way to share that, let's call it a software update, through the system, and it takes that messaging and it interacts with our initially messenger mRNA and then DNA, and it becomes part of our ability to deal with things. So we've had a very useful outcome. Now, the odd individual in that era, it was usually the young people that suffered most, had a cytokine storm, and some died, many died. Whereas, the current one primarily is the elderly, and no major relation. They often try and compare the two entities, roughly 100 years apart, but this one has had zero difference to all-cause mortality. We talk about more than 500,000 deaths in the United States, but it's partly a naming thing that's made that, because the number of people dying each year is about the same. So as far as a virus flu goes, this is roughly the same as 2017, 2 or 3 years ago, when we had a rougher one than usual, because we had a milder one in many parts of the world in 2018 and 2019.
Mm-hmm.
Yeah. So,
mm-hmm. Okay.
So to talk about the, the microbiome, reactive, and the terrain, health of the terrain. So one of the things that makes a difference within enzyme function in the body, of course, one's temperature, that's a big one. But the one I wanted to mention that's 2 or 3 years in the recognition now, and I learned it first from Dr. Bill Shaw at a conference in Vancouver, but this is the effect of the enzyme in about a third of the population. So that could be almost all of us with those brain illnesses, frankly. That third of people are exquisitely sensitive to the effects of cheese protein or casein from dairy, and then gluten protein. They both suppress that enzyme. So all of a sudden, you've got two major food groups that a lot of us rely on a great deal, having a similar action to that Clostridia overgrowth and the subsequent toxins that were circulating. And so, of course, they can be additive with one another. So if you change the terrain and you take them virtually out of the diet, the dairy and the gluten, you may dramatically reduce that individual's trouble with depression, anxiety, autism spectrum disorder symptoms or challenges, as well as OCD, obsessional compulsive disorder, and even schizophrenia. And I've seen some of these cases like that and put them in the book, because it's dramatic when you can realize that you can make such a difference, feel empowered yourself, that you can start to make those differences, because these become important terrain pieces.
Yeah, and often in children, if there's a particular food or a couple foods that they continue to gravitate to over and over again, it can be kind of because things like that they're acting like opioids, and so it's addictive.
Exactly. And those two examples I gave you, gluten produces gliadomorph or glutinomorph, depending who you talk to, but that's a morphine-like substance that the body makes, acts on the opiate receptors in the brain, and has some so-called gratification or happiness reward. And
so and actually, it's not just children.
Gravitate to.
Yeah, I've definitely noticed that type of behavior in elderly as well. Probably adults, although I think those of us in adulthood seem to hide it better.
Well, we do hide it better, but we don't want to admit it either. It's a pretty normal thing, because we want to carry on what we're doing, what we're used to. And we want our happiness feelings wherever we can get them, and that's a place. And the same happens with caseomorph, secondary to casein. Again, you get that morphine substance, and you take that away from people, they get really grumpy for a couple of days because they're going through a type of withdrawal. And very real. And it's very satisfying at the time. We've all been there, but we pay the price later. I think that was probably one reason I was so hooked on ice cream, frankly.
Yeah, I didn't realize you were going to talk about that enzyme today. Otherwise, I would have tried to look up whether it can be produced by any of our microbes, because it's getting more and more possible for me to fairly easily check which enzymes can be produced by microbes.
Okay, well, that's fair enough.
That brings me to my other point, though. So the microbes also produce vitamins, which can influence our mood.
Absolutely. I mean, the big one I always think of is B12, but there's more than that, isn't there?
Definitely. Yeah. I mean, you'll remember at one point I did talk about how the way my microbiome was situated in the fall, it was upregulating B9. So I couldn't supplement with any B9 at that time.
Okay. So, and a B complex would probably have 9 in it, right?
Yeah.
So now you don't feel good on what you think would make you feel good.
Yeah, exactly. Yeah, it was strange. Other things that I would look for related to the microbiome, I also look for histamine. That's a pretty big influencer of mood, and it can interrupt your sleep too. If you interrupt your sleep, then your mood is probably going to tank.
Yes. Yeah.
Mm-hmm.
Well, yeah, we've kind of brushed over sleep here, but it really ties in. A good
Mm-hmm.
night's rest, optimal conditions for that, whether it's darkness, lack of Wi-Fi, and all these other pieces allow that brain melatonin production to be increasing through the night, and all of these important parts, because serotonin and melatonin, pretty close cousins, dependent on one another.
Yeah. And lack of sleep has been found to interrupt the blood-brain barrier.
Mm-hmm. Yeah. Well, it's still, if you want to break people, mess up their sleep. Do it for several days on end, and we all crunch or crash or some other variation of it. So the importance of sleep is exquisite, and I'm a really big fan of that. And drug-induced sleep usually doesn't work, tragically. I mean, you feel better in the morning, but has it done anything? I mean, we've done sleep before, but it's incredibly tied in. And it also, lack of sleep messes up the microbiome and shifts it, doesn't it? Shifts it away from diversity, shifts it to some of the tough actors, I guess. Yeah.
Right. And I suppose, okay, so I have a couple of questions for you. When I was notifying everyone that we were going to be doing this talk, I put out that quote that said, well, depression's not a chemical imbalance, it's brain inflammation. And I got a couple messages back from people saying, well, that makes it sound terrifying. What do you have to say to that?
Well, I guess two things. I mean, theoretically, the head and shoulders of all of pharmaceutical-based psychiatry was based on that premise, which was never actually truly proven, that serotonin and other neurotransmitters were reduced. Okay, we theorized that they were, and that's really about as far as we truly got. Okay, no one's ever done studies of the cerebrospinal fluid to confirm that any of those pieces were happening. The other part that ties into that is we've got to get people to come to grips with they can control most of what their problems are. But the root, I was going to say the root of all evil, but the root of all challenges is misplaced or excess inflammation. And that's nowhere more critical in the brain. I mean, you've heard me go on tangents before that one of the big triggers is hypoxia, but it isn't in everybody. It is in a group of illnesses, but it isn't as much in the psychiatric illnesses. There's a crossover between the psychiatric and the illnesses when we talk about brain injury and PTSD, which often go together as a similar diagnosis, or they can be separate as well. But PTSD, I would suggest, is mostly thought of as being a psychiatric diagnosis, whereas, brain injury or traumatic brain injury is more of a neurologic one or medical one.
Okay.
So, I didn't fully answer that, though, did I? What was the other piece? Does that
pretty
kind of fill it in?
That answers it. I mean, I think
Because
no
we
matter
have to,
what,
yeah.
yeah, the point is that you can attenuate brain inflammation. And that's really what we're getting at with the book is here are all sorts of things that you can do to
Well, that's right. And you're not going to be successful with reducing brain inflammation unless you're successful at reducing gut inflammation, because they're that tied together. If inflammation's happening in one, you can guarantee it's happening in the other. Lower down. So that's why, sit back and look at how can we get that inflammation to calm down. So we want to take the toxins out of the mix, and we've talked about glyphosate before, and we've talked about heavy metals to a modest degree before. I saw a 77-year-old woman who's had many, many years of MS, and she still got, a modest number of molars filled with mercury or amalgams. So, it's not hard to see that's a piece of her challenges. in the loop, and encouraging her to think about removing those even now at this stage of life. So it's a matter of trying to figure out where are the pieces that we can change. I liked it because it made a big impact on me when we had that article in Time on the front cover. It had the brain literally with flames, okay? Because these are the pictures that stick with you. And so, oh, okay, that's pretty graphic. That fits. And having had depression, myself, and spent 20 years on antidepressants, although it's 15 since I've been on any, probably, roughly. And I'm hoping I know enough now that I don't ever go back there. Not that I liked it at the best of times, but it's a matter of trying to empower yourself. What are the pieces of the puzzle? From the name of the book, I guess, Solving the Brain Puzzle. But what are the pieces that work for you? And yours is a very useful journey to you and in teaching others, because it's been a fairly challenging. It hasn't been, well, I just take this probiotic and I'm good to go. It doesn't work that way. And even if you had the right probiotic, it didn't necessarily work then because something else was out of kilter on the way to it. And you gave the example of the hydrogen sulfide. So it's, some of us will be lucky and we can do it fairly straightforward. Maybe we can do it in the book where you and I are trying to educate people, because you've done that, the new replacement chapter on the microbiome in the upcoming edition. And it's a matter of really trying to sort it out for that individual, because we need a degree of individualized medicine, because we're not all the same. We're on some sort of bell-shaped curve with big variations among us, and some things we'll have in common. Yeah. Heavy metals are not good for anybody. Short story, that's easy, okay? But particular foods or groups of foods some of us can handle, and some of us would be better off without them.
We have some pretty good testimonials from when we had our Tame Out Canada clinic, and we did have clients come and they did try the fecal microbiota transplant for their mood disorders. And I do have one of those testimonials still up on the blog on my website, if anyone wanted to look at that. And I am seeing more and more testimonials for the fecal transplant for mood disorders all the time. It doesn't work for everyone, of course, but for some people it does work quite well.
Well, that's right. And so, it's a thing to reach for, yes. And I had it several years ago. I still do it occasionally from time to time, and it does help reset things and restart things. Not everybody's going to be able to reach for it yet. It's still quite tricky to get available unless you're in a research study. You can't in Canada, United States. You can in some countries in the world, which is good. But even those countries that were doing it, COVID's kind of messed them up. So it's hard to get in the Bahamas. It's hard to get in Slovakia. It's relatively hard to get in the UK because you can't get over there. So all of a sudden now we're back to where we kind of were before. We need to do all the other nuances, which may work, but will take longer, or they may not fully work, but we can only do the best we can in the short term. Knowing that if we can get that terrain more sorted, and mostly it's what we put in our mouth, or breathe, as far as the water quality and the food quality, or what we breathe in our nose as far as the air quality, all of these are impactful in what we're doing. And if you're living in a very toxic soup because you happen to be in a part of the world that's like that, it's going to be a real challenge to get it all sorted. But hope springs eternal. People can't get onto an acreage fast enough where I live now. It used to take 1 to 2 years, and now they sell within weeks, and often, well over the asking price. It's uncanny because we've got that urgency, almost an urgency. Because, you mentioned forest bathing, which maybe you could explain for us, because not everybody knows what it is, but I think of it as one way to think of it. I'm sure this isn't the classical way, but walk with nature, time with nature. We know that there's, substances that we can get walking through a pine forest, which improve our mood, improve our well-being. And this is subtly changing the terrain around you and within you, because nature's got this mostly long since sorted out. And if we can embrace that and share that with nature, then we're in better shape to recover.
For me, forest bathing is all about balancing the nervous system and getting that parasympathetic activation to kick in. So for me, I like to just go for a more gentle walk than I normally would, and go somewhere where there is really like nature to appreciate. Like just this past weekend, a friend and I went for a walk to the Gold Stream Falls, and there was only a couple other people out there. We had the falls all to ourselves, and it's just nice to look at the falls and be like, okay, good job, nature. Like, you look really good today, and have that sense of appreciation.
Yeah.
It's another way to cultivate gratitude. At the same time, you're also absorbing negative ions, and you get a break from the chemicals and whatever other things you're usually exposed to.
Well, and the other brilliant thing is you're taking time and patience, energy for yourself. And there's no entity probably better to remind you of that than nature. And it might be a variation on nature. Maybe it's going to be time with a horse, or time with a dog or a pet, because each of these is a piece of nature which helps us get a little bit outside of ourselves, where we can run in a real almost rat race within our brain and mess it up. So I was just going to follow up.
Questions.
Yeah, we got a couple of
fan
questions.
of sleep too, but with fibromyalgia, it limits healthy sleep and it adds to depression.
Well, sure. And so it's a tough cycle that goes round and round. Fibromyalgia, or myalgic encephalitis, depending where you live, whether you're in Europe or in Canada, United States. But we know we have modalities to help fibromyalgia quite considerably. We've talked about them a bit before. I mean, if you do a repeated degree of sessions in hyperbaric oxygen, you can settle fibromyalgia right down. If you do a series of laser treatments, cool laser or photobiomodulation, that too has been shown to really calm down fibromyalgia. And also, we know that fibromyalgia, a big piece of it, is lack of optimal mitochondrial function. You know, I've said before, my three favorites to try are CoQ10, acetylcarnitine, because it's often brain related, or you might get away with carnitine if the fibromyalgia is only in the periphery and you're not getting many kind of brain symptoms, although the fatigue is a part of that. And then D-ribose. D-ribose, of course, is a 5-sided sugar, which circumvents and often provides more energy to the mitochondrial pathways. But at the same time, the mitochondria are very much in tune with the terrain around them. And if you can get that better, then they tend to improve. And I think there has been some microbial studies on fibromyalgia as well, that often that will calm it, settle it down. Okay, so you've got multiple choices, although you don't have all the FMT choices right now.
Yeah. I would wonder, Lisa, is it the pain that's keeping you awake, or is it just decreased sleep quality in general?
Yeah. So maybe you can get back to us on that, Lisa, in another part in the chat. We've had another question while you're responding to that, Lisa, from Heather.
What is the expected time frame to repair the microbiome? Well, it takes 8 weeks to make permanent shifts to the microbiome, but often that's kind of just the beginning. I would say if you have pretty strong imbalance, give yourself a year, sometimes more. In my case, it's taken a couple of years for me to get to a place where things are stable. So you want to have a resilient microbiome that doesn't shift at every little thing you eat or do. And that's what used to happen to me before. It was like, okay, I would eat like an apple, and all of a sudden my gut's gone out. Right? You don't want that to happen. You want it to be strong and stable and resilient. And for that to happen, sometimes it can take a year or more.
And it's a lot like health in that way, because this is health. It's a big, big piece of health. So be patient, be gentle with yourselves. As long as you're making improvements along the way and you're improving the whole entity, you're winning, okay? Because, you know, the other tragedy is, and this is what people expect to do, I'm old now, I'm over 40, whatever, it's all downhill from here. And my doc just tells me, oh, you're getting older. Well, I don't buy that, because most of it you can empower yourself and start to shift it to make it better. So I know that by the middle of the second week when I was having FMT, I noticed the first glimmers that I was getting a benefit from it. Okay. And so those were, improved clarity of thought in the morning. So less brain fog in the morning, because I'm very sympathetic because it happens a lot in MS. All right. And at the same time, I had some degree of more energy. So I suspect the mitochondria were starting to function better and all cells were starting to perform better. And at the same time, I've needed to continue to work on how I can improve that long term. So I've done a lot of things since that FMT. I've done other kind of top-up systems every few months, but you just have to be patient because most of us didn't get our chronic tough illness, fibromyalgia being one of them, depression being another. They don't happen in a week or two. They happen in months, sometimes years. Okay, so we need to be a bit patient to push the ball back up the hill. It's going to take some time.
And when did you come off SSRIs relative to doing the FMT?
Probably 10 years before, at least.
Oh, okay.
Yeah. So, those weren't really connected in me. I'd found other solutions other than the SSRIs, not the least of which was, treating hypothyroidism and calming down, I think, part of the inflammation in the MS because my MS symptoms were receded or reduced some. And of course, that reduces inflammation if we use our fire on the brain model to calm it down. So you can notice differences. And I'm not sure when you got your first differences. I know you had a few setbacks along the way, but we have to try and give ourselves permission. We will have some setbacks as we learn things, and something new will come along, will shift things. Maybe a forest fire goes through your community. Well, you're going to have really tough breathing and consequent issues within your body for months after that, because that's a huge challenge or insult. Okay. Or maybe you're lucky and have a near drowning event or car accident. Any of these pieces of life get in the way. It doesn't mean you have to give up. It just means that you've had a temporary setback. You've now got a few issues to help let your body heal with, because it will, but you need time and patience. And you need to honor yourself that it's worth you getting better rather than giving up or putting it onto someone. Think, doc, well, that doesn't work very well, unfortunately. For you or the doc, for that matter.
I know one of the things you had tried plant medicines for your depression, and there's a lot of good research coming out on that now too. I was actually just watching a documentary yesterday about a hospital in the UK where they are using medicinal mushrooms to sensitize the serotonin receptors.
Well, that's right. It's almost magical how sometimes these components will work. So one of the other agents that's been used for couple of 3 years now, it's getting more popular, is ketamine, which we've had an anesthesia and in veterinary anesthesia for 50, 60 years, maybe longer. Okay. So tiny amounts given in reverse things or almost reset the receptors, just as you alluded to. I think one of the really exciting ones that's starting to get more and more possible is the look into psilocybin and the mushroom components. All right. The other one that fits in there to some degree, especially on the anxiety piece, is the CBDs of cannabis. All right. Because they can make a huge difference to resetting that. They sometimes make a huge difference. There was a great head-to-head study, I talk about this in the book, of CBDs used in schizophrenia, like hallucination symptoms, and it worked as well as their favorite brand new antipsychotic drug, but not as many side effects. Okay, so, and I would put cannabis in the herbal group. It's a little different than psilocybin and magic mushrooms, but magic mushrooms are much more trendy and exciting these days and will have a really important place. Just in the long term, but we're in the nuances. It's tricky to do those in a lot of parts of the world yet, because we've got an angst and a fear around them.
Yeah. I guess one question I have for you would be, so say you have a new client, they come for their initial consultation, their main concern is the depression and anxiety they're experiencing. What would be the first either tests you would run or inquiries you would make?
Well, when I see someone of that, I need to make a decision in conjunction with them. Are they at risk of taking their own life? Because that makes a huge difference with regard to the urgency. So most often, certainly when they're seeing me, they're not in that group. But I need to know how critical that one is, because if they're possibly harming themselves, we have a whole new set of urgency. But saying that we've looked at that, we've solved it, people have a lot of reasons that they want to continue to live and get better, then we move on to what the other choices are. So I try to get them something to get their sleep back. Okay, if they're not having sleep, I will do my regular labs initially. I want to make really sure there isn't a hypothyroidism component, and I'm quite aggressive at trying to optimize that and make sure they don't, because that's missed way too often. And then so that would probably be the number one set of symptoms that I'll go through, because that one will be fairly quickly medically solved, with desiccated thyroid hormone, okay? The other pieces that we would go through are their main clues in their diet. Are they crazy about dairy? Oh, I couldn't stop dairy, doc. Okay, probably going to have to get them to stop dairy, but you've got to get their confidence first to some degree, because that's a big shift. And so if they're really stuck on either their gluten or their dairy, and I can get that just in the story, and sometimes a set of bowel symptoms, but often not. Okay, the bowel symptoms aren't always there, and you can't exclude it just because there isn't any bowel symptoms, because neurologic or psychiatric issues are the bigger deal. So then I would probably do a food sensitivity testing, IgG panel, Great Plains, or some similar lab, because I find a lot of people, and guys are especially bad this way, you've got to have objective evidence for them before they would make such a dramatic change. Okay, that's fine. So their coin, they have to pay for the test, and I'll go for that. However, if it's more of a gray zone, and I think I've covered all of the regular bases that we initially talked about here, I probably then start to reach for an organic acid test and a hair metal analysis test. The hair metal analysis tells me a lot about heavy metals, and it tells me a lot about trace minerals. And one of my favorites here is lithium, okay, to check, do they have relatively zero lithium? And everybody living on a wet coast, like we live here on a wet coast, tends to have extremely low lithium because there's not hardly any in the soil. I would put it in a little bit of a parallel. It's different. It's different from selenium, but it has critical features. And if you get a lot of rain and it washes these minerals down through the soil, then they're not in the crops that are grown. All right. And all of a sudden you're aggravating that deficiency. And that's why the measurement's so important, because once in a while people will have a quite adequate lithium. More commonly, I would guess that's going to occur if they're living in Midwest in a relatively dry climate, desert-like almost. You can get huge waves in and around Texas, okay? Even though it isn't that dissimilar, some have more in the soil than others. Lithium's a pretty common entity, but it's in a trace mineral group. We haven't labeled it ever yet as an essential entity, although I think that day will come eventually. So I'm only talking for replacement of lithium before you get uptight about taking these big doses of lithium carbonate, which was in the 600, 900 milligrams a day. I'm talking 5 or 10, okay? A big spread, huge difference, because lithium has a J-shaped response curve. And if you're down in the lower J section, you can do a lot with 5 and 10 milligrams a day, or sometimes way up here, you'll need quite a lot more. Now you're under the care virtually of a psychiatrist, and you're needing it to handle bipolar. But some people, even their bipolar, which is, you know, the variation of mania and depression, sometimes they're stuck on A or B, sometimes they alternate, can often do very well. I've met a woman that if she did 4 milligrams a day of lithium, she didn't need any of her other medication for her bipolar entity. So these are really subtle, small changes. But if we get the hair testing, that's roughly what, $100 US. That tells us a great deal of information. And then the organic acid test, which we've stressed a little bit others, and we'll get back to it again. It starts to fill in clues. Is there something lingering? Because it gives us an initial picture into the microbiome, doesn't it? It gives us an idea of the fungi involved. It gives an idea of some of the potentially aggressive bacteria involved, as well as other subtleties along the way. How are things interacting with regard to the dopamine pathway, the dopamine breakdown pathway? And it can give you much of those information, as well as some information on your vitamin component.
Yep.
Are you short of B12? Are you short of CoQ10? And all these other nuances that start to let you individualize that person's challenges and entities. And the story that I always would ask that person with depression or anxiety, what's their energy level like? Too often missed by regular docs because everybody's tired. The doc's tired, so therefore everybody's tired. Well, everybody isn't tired, but if you are tired, it's a big clue. Part of this might be mitochondrial dysfunction. And mitochondrial dysfunction is way too often downplayed and or ignored because we don't have a drug that we can give it to boost it or solve it. And so we don't have it. But that doesn't mean it doesn't happen. It's really common.
The other marker that the oat does is B6, which is hugely relevant for neurotransmitter and neurotransmitter breakdown. So
for sure. I mean, yeah.
So I've got for you, so far you've said, so make sure they aren't at risk for taking their life. Then from there, if they're willing to try an integrative approach, you'd probably do a thyroid panel if warranted, organic acids test, hair tissue mineral analysis. I have seen what you do for clients before, and you've missed this, but you test vitamin D too. And
should have put that right at the top, because lack of vitamin D can be a depressive quality and can be a whole host of things. It's a very critical piece of the terrain. Okay? Probably the very biggest piece we can do, and it impacts on 2,000 genes as far as its epigenetic principle, turning the good ones on and not so good ones off. So, but thank you. Vitamin D is always right on the list because it's one, you know, I'm lucky enough as a specialist, I can order it and it's covered here in BC, although you almost need an act of God to get it in some parts of the country, Canada. But everybody now can access it because you can send it south of the border or you can send it to particular labs here in Canada. Or if you can talk your doctor into prescribing it in some, or sorry, recommending it on lab requisition in some provinces, you can pay your own $60, or you can pay $60 and get it done in multiple places in the United States. But a really useful thing to discover.
I've also seen you run fasting insulin, fasting glucose, and A1C, which can be relevant if they're off.
And C-reactive protein, okay? Yeah. So just to go back to that, this is partly following the inflammation concept, inflammation of the brain concept. Is that how big a factor here? And is higher sugar doing that? Some I can get on history, okay? If people are doing 8 jugs of Coca-Cola per day, yeah, that's pretty straightforward. A little side nuance in there is really hard on the brain function are the artificial sweeteners. I hate aspartame and most of its cousins or colleagues because they trick the body, but the body isn't tricked. It still needs the sugar, but now you've got some other very tough side effects for the other. So by looking carefully at the fasting glucose, or the hemoglobin A1C, which is kind of a 3-month average. I mean, I've been in practice long enough. I used to have a patient, we would go out fishing together, and he'd make a big deal because he'd eat big dose, eat a meal of pie, fruit pie, in front of me, saying, because he knew if he was pretty good about his diet for 2 days before he came to see me, his fasting sugar or blood sugar was pretty good.
Yeah.
But just in the time I was practicing and seeing him, because I was 4 years in general practice, the hemoglobin A1C came along, which means that you're using the hemoglobin membrane and you're looking at, what glucose is in it. And it's kind of a 3-month average. All right. So all the tricks go out the window. So it doesn't have to be done fasting either, but it can be a pretty good indicator where things are. But if you're looking at more subtle changes, now you've got to measure the fasting insulin first thing in the morning and try to get an idea where those things are. Because when those are starting to slip off the rails, now you've got to try and get them come back to the core. And in redoing the chapter, this is an interesting piece. This is new to me anyway. In the early 1900s, when we finally had cities being supplied their power grid. So before that, it was candles and gas lamps and darkness. Okay. So we changed that, and they recognized, it took them 20, 30 years to realize, that's when heart disease started to climb, cancer started to climb, and diabetes started to climb hugely, because the electrical signals that go with so-called dirty electricity, and I explain more in the book, and we'll redo that chapter at some point, because there's a lot of important stuff, and there's a treatment model to help it, that you can change things in your home, and you don't have to give up power, which is going to be really popular with most of us, because we really like it for all the things it does for us. So if you can, sort out where they are in that pathway. The other one I would do in that routine first visit, right after vitamin D, I typically write C-reactive protein. Okay, C-reactive protein was initially to see where are you in the heart disease continuum. Is it starting to creep up? And it's a general body measure of inflammation. It isn't always high in a depressive patient, but sometimes it is. And then I start to think of how I could treat that. In a perfect world, I would at the same time be measuring their omega-3 and omega-6. But that takes an act of God, nearly 2 in Canada. So I would need to be sending down where they are in that. Although I can often do it very much on history and story. If they're not using any, trans fats, and they know about that, hooray, then they're pretty good. But if they're only using omega-6 oils and there isn't any fish oils in it, or omega-3 oils, which you would get from flax, ground flaxseed, and other sources like chia, then all of a sudden we may have a big problem here, because omega-3s reduce inflammation, omega-6s increase inflammation, and trans fats are horrendous for increasing inflammation. So we can't do those in measurement, but we can often do it in talking to them. And where are they willing to move? And my 3 favorite things, it fits in pretty well with today's talk. Always get them more vitamin D if they need it. Always get them on more fish oils if they need it, and most of them do, certainly if they're depressed or got cardiac issues or arrhythmia issues. And third, probiotics or prebiotics, and enhancing the quality of the microbiome. And so now, a few kind of stock things when I go through those, but I have them see you at Mind Mood Microbes. Great name, fits in really well with what we're talking about today, because it's really tied in, and we can do a great deal, but it takes a bit of time, a bit of patience, and sort of through. We don't always have the straight hot button of FMT.
One more thing I wanted to mention. So with the SSRIs and the antipsychotics, because people watching today they may have used them or they may be using them now. If you ever plan to come off of them, make sure you come off of them slowly, and know that you are going to have work to do, at least microbiome wise. I'm sure you'll be able to comment on the other areas, but what happens with some of those drugs is they do have antimicrobial effects. So actually with a couple of the SSRIs, citalopram, for example. Those are antimicrobial against the microbes that do contribute to your own serotonin pathways. So that is likely why FMT has such a good effect for some people. But you can also do it with prebiotics and probiotics. Bring those microbes back as you're reducing the SSRIs.
So, and we've talked about a bit of that before, because that's very much the approach of the folks at point of return. You've got to be very slow. You might get away with 10% a week on SSRIs. I mean, to a regular physician, a slow reduction means cutting out half, 2 weeks again, cut out half again, and then you're off. Okay? Doesn't cut it. It's way too fast for most of us. And one of the interesting reasons for that may be that huge shift that it's creating in the microbiome. Okay? Mm-hmm. So we need to be cognizant of that, but you've got to really slowly taper. In a perfect world, you'd find a consenting physician and you could get a compounding pharmacist to help you do that reduction. That may not always be possible, but that's a challenge that you may have. So we've got another question I was going to try and work on. Does vitamin D support mental illness? That's from Diane. Absolutely it does. It's a very huge factor in the well-being of the brain and the gut. We know that even 2,000 international units per day, which isn't enough in almost all of us, we need at least 4, but at 2 it starts to become anti-inflammatory. Okay, so that's good, not just for arthritis, but it's good for your mental depression and other issues, and probably even your anxiety. It's uncanny, and it needs to be taken at least 4,000 international units per day. If you've got a malabsorption problem, like if somebody's maybe on 4,000 units a day and they still get their vitamin D in their boots, they've got malabsorption till proven otherwise. And you hardly ever prove that it is otherwise, because it's almost always malabsorption. It may not only be gluten, but it may be a host of other things that are really messing up the gut microbiome and the absorption capabilities. You get other clues out of B12, homocysteine, and so on. So then we have another question is from Kathy. Any concepts about the new jab using messenger RNA to stop MS patients' immune systems attacking neurons? Well, I'm not excited by the idea, frankly. We've been working with messenger RNA concepts in this jab for a long time, and now we've got them, and we're experimenting on them with people. So I think they're at risk, because there is an increasing number now of neurologic sequelae happening from that jab in the arm, okay? Mm. And it's triggering MS in people that didn't have it before, which tells me it's probably not a great idea for folks with MS, personally. My personal choice now, my personal choice would be to avoid it. That's what I would do. Everybody has to walk their own personal journey. I completely get that, but I sure don't see it as a panacea for helping one's multiple sclerosis. That's my personal belief. Okay, someone's got, Naveed's talking about vitamin D. They take 5,000 international units per day and are in range when they measure it, which is great, okay? So if you're in range, so when I talk about range, because I think our lab here reports at 75 to 150 millimoles per liter. Now you would have to take that by a factor of 2.5 if you're going to convert it to the US numbers, but many of you are Canadian, so we'll talk on those, and Europe would use the same ones. So if you're in range and you're 75 to 100 and at 5,000 a day, I'd kick it up to 6 or 7, okay? I would prefer your vitamin D to be about 125 to 150 millimoles per liter, because I'm trying to talk optimal health for you, all right? Mm-hmm. And I accept, you know, certainly up to 250. You're probably fine up to 400, but 250 is a guiding light for upper normal. I mean, I've measured mine at 300 once, so I had to back down some. Everybody got really excited. I didn't get very excited because I knew it wasn't a risk factor. They did a curious experiment in Boston by accident. 20, 30 years ago, as you know, vitamin D2 is added to milk. Okay, so 8 ounces, you get maybe 200 international units of milk. I don't drink milk, so it didn't matter for me. But anyway, 2 little old ladies got very high serum calcium. Nobody died in the event, but they were given millions of international units because of this mistaken math, I suppose, when they added a huge amount of the milk. We never heard much about it. Nobody wanted to get their backside sewed off. But, you know, it happened, and it was a test that happened within nature, so to speak. Yeah. So being in range is one thing. And just because it makes your dock warm and fuzzy because you fit within the bars aren't always in the right place. And I don't mean the drinking bars here, but I mean the range of normal. You know, if a dock's being lazy, they just see, is there any stars, meaning that there's something above or below the normal range? If no, then they're golden. Well, you know, I prefer to look at some of the numbers more specifically and accept what I see as potential optimum health. I remember I used to get it from Dr. Lewis Cady. He said that the normal range was just designed for people being not sick. It had nothing to do with optimal health, but it was just not being sick that you could see on a lab value. Well, it's worth more than that. And now that we've expanded what we can do in the lab, we can learn a lot more about the details and find out more. Okay. No, we didn't hear any more back with regard to the sleep and the pattern. There's no question that pain during sleep or pain during the night when you're trying to sleep can really aggravate the problem. The downside is some of the things we commonly use for that pain mess up our proper deep sleep. One would be narcotics. Another would be non-steroidal anti-inflammatory drugs. A third would be sleeping pills. Okay, they mess things up. They take away quality sleep. So there might be a Band-Aid for a couple of days if your, loved one gets super sick or killed in a car accident. Okay, fine, fair enough. You can use it, temporary Band-Aid. But it's a horrible long-term solution and only does bad news for you. Okay. I guess we've rushed ourselves into overtime. People are having dinner. My apologies. Got carried away, long-winded. But so a really exciting time. And if you folks want to follow up, please do so. If you want to see this, go to drbillcode.com, look under blog. Everything's listed there as far as the podcast we've been doing for coming up a year. It's getting close to a year. Many are listed. They're not every week. We probably won't be around together next week, but save your questions, send them to us. You can send them to, what's your preferred email if you want to send, or they can go to your website. Go to your website, info@mindmoodmicrobes.ca.
Actually, so the email with the website is mindmoodmicrobes@gmail.com, and then the website is www.mindmoodmicrobes.ca.
.ca. Okay, perfect. I will try and remember it. So anyway, if you don't have your copy yet of Solving the Brain Puzzle, it's now available printed in French, Spanish, English, and of course, the ebooks and the audiobook. So audiobook is available also on my website for those of you that don't want to read while they're driving, and I hope no one does, or audiobook, because it took me quite a few hours to dictate the whole story, but well worth the purchase, and you can find it there. Okay, have a great week. Thanks very much, Christina, for sharing things with me. Pretty exciting things happening ongoing with the microbiome. And
Definitely.
So be well. Take care.
Yeah. Bye, everyone.